Introduction, my name is Julia Keller. Been an x-ray tech for 44 years. Trained at Johns Hopkins Hospital, did trauma 9 years. In the 70s, no CAT scan, skulls were the thing, correct? No CAT scan, so everything was done with the skull. After CAT scan came about, no more skull. Now this is my lovely model Tom, and he's going to be our victim, our patient today. Now, I want you to turn and face the board, sir. We talk to our patient with respect. Don't position it.
Oh, sorry.
All right, the first position will be, we've got him, turn around this way. Let's go with your AP skull.
Oh, AP skull.
Put your back. Now, what you do, you have the patient tuck their chin. You want that's
orbital line.
Yeah, you want it perpendicular. Now you're going to angle your tube 30 degrees. You want to get through the foramen magnum.
Okay.
And you're going to make sure he's centered. Chin down.
Orbital line perpendicular,
Yeah.
and you want the angle.
Yeah.
What's the angle?
Around 30 degrees.
30 degrees.
This is a
Now,
town? What is this one?
town. This is a town. 30 degrees. Now you're going to put your marker right up to the ear.
Okay.
Near the ear, you don't put it too close, and you're going to come in. There you go, that's all the pin you need. You're going to bring your, where's your body? What do you call that thing? Yeah, button. Alright, now, skull takes about 40 mass and 70 kV. If you do a manual technique, photo time, it pops up itself. Now, now we're going to swing the patient around and do a PA. Now the PA...
PA is the second view.
Yeah. A PA, the forehead and the nose
The
will
Mangela
touch.
and
Yeah. Will touch. And you always... Now, this goes to a 15-degree angle now. 15 degrees for the PA.
This is a Caldwell?
No, it's a PA. Caldwell's for the sinus. And you get just within the light. And if you can see both ears, coming
what
with both ears.
box did you just 8 by 10?
10 by 12.
10 by
You
12.
can manually do it. Now, to see if the patient's straight, see both ears?
Yes.
They're pretty perpendicular. When they're PA, they're a little more harder to see.
Okay.
But I look at the ears. And if I can see the ears and they're symmetrical, then you got a good PA.
God, I'm so happy.
All right, go ahead and you position them
And
now.
I'm so happy comments.
Position the PA.
Okay.
Now, tube's angled already.
What do I do, sir?
Sir, you're gonna just place your nose and your forehead on the center.
Okay, is this good?
The other way. So I'm gonna be holding your
Okay.
face. I'm gonna put it like that. And then I'm gonna make sure your ears are equal on both sides and they look absolutely equal. Sorry.
And I usually shoot through the glabella. To the glabella.
So you
that's
line
the
up
eyebrow.
right there.
At
The
glabella.
glabella is
Yeah.
your eyebrows.
Right.
Okay, I think this position is ready,
It looks
sir.
Pretty darn good.
There's no respiration technique for the skull.
I say do not move, breathe, or swallow.
Okay.
Because if you don't, if you swallow, you move.
Yep.
If you solo, you move.
If you're doing it right.
You're
Okay.
doing it right. Now we're going to do lateral.
The
Right
lateral.
is perpendicular.
Sir, you're gonna be.
Now he's going to be semi-prone. So you just push him up against there, turn his head to the left, very gentle.
Oh, really? So there.
Semi-prone.
Okay. It's,
Now,
Like this, right?
now, like this. Now you're going to tuck their chin. You want this line perpendicular,
perpendicular.
and you want to make sure that the glabellas are perpendicular.
Yeah.
Now
And
you're
for
gonna,
instance, right now he's a little tilted.
well, then I'm tilting.
Oh, you tilted?
Or-
Now he's good.
Some patients can't do this, so you can
Yeah.
angle down.
And the central ray is again at the Mangela.
No, it's a little bit. Is it a
Little
half,
bit,
half an inch superior to the IC, the EAM? But really, what you want to do is look here. See,
Yeah.
you've got the back part and the front part equal.
Yeah. He's still tilted though.
No, my neck doesn't bend like that.
Well, if they can't do it, let me show you what you do. Put a little angle in here.
Okay, that's
The angle
it.
will take away the tilt.
That's it. Now the line is
Yeah.
perpendicular.
The pupils.
Yeah,
Yeah.
I can see.
Now, you do the other side. Do the
Okay.
other lateral.
That's
Okay,
tough.
sir.
It's tough when I brother's neck. I'm not gonna lie.
So I'm gonna press you against the receptor, and then I'm gonna turn it. I would really look here, and I need to raise the IR.
I call it a fang. When you're old, you forget all.
It's about a half-inch below the Langella, so that's
Look up.
perfect.
Now you have to look here, because there's your 10 by 12. You're gonna have your 10 by 12. You're gonna have to raise this up. This is
Or to adjust.
to adjust. That's
Yeah.
the top of the 10 by 12.
Yeah,
See? You want the top.
and right now it's perfect. Actually, this position is perpendicular,
Yeah.
half-inch below the Langella,
Go ahead.
Well,
the vela.
yeah, or you go a half inch above the here, the hole in the ear, EAC.
Okay, so
That's-
it's again,
that's
it's the
all
orbital
right there.
line.
Yeah.
Okay.
Most you saw work.
Look at these baby blues too, make sure.
You
Yeah.
do have pretty eyes, so it's not very professional for me to say.
Now,
That's all right. I
Now,
love compliments.
we can do a Haas view in near of the towns. A Haas view is in reverse. So, you go get them PA.
That's a fifth view for the skull.
Well, no, it's
It's a
another
special
one.
view.
Not special. If you want to do everything PA, instead of flipping them around,
Yeah.
you can start with this. Now, what you do, you angle 30 degrees up. You go through the foramen magnum. That's a reverse town. It's a Haas. Haas. Is that right, Tom?
And still chin down, forehead.
Yeah, you still get them in the same position. But you know, I can't bring the tube down, but you're gonna be angling through the foramen magnum. That's
Okay.
for the posterior skull. The PA is for the anterior.
I see. So this one is for posterior skull.
Yeah, a Haas and a Towns. That gets the back of the Wiener.
Posterior skull.
Haas and Towns.
Okay, yeah. The first one was a Towns.
Yes, and the PA is for the front part of the skull, the manual. Now,
Right.
we're done the skull. Do you feel comfortable?
Yes. Yes.
All right, now.
Yes.
Now we're gonna do sinuses. I do.
Nice.
You
Now-
want paranasal sinuses.
Right. Now,
Okay.
this is for a normal patient that's not coming in the ear all drunk up, beat up, or
I
yeah.
made an X-ray by
Now,
Paranasal sinuses, I saw one happen here.
right. Now, we do a Caldwell's, which is 12 degrees in a PA position. So, put your head down, sir.
Okay.
Straighten that Wiener up. Now, you're gonna angle 12 degrees down.
So we
And-
will put that.
And the sinuses are right along here, so a little bit above the glabella, you're gonna angle. And you don't have to, you can cone into the sinus themselves. See, you don't have to worry about the skull.
No more,
The
because you
sinuses,
did that.
the sinuses are here.
Yeah.
So you can get a
And
little
here,
fancy.
right? This part.
Now, once again, you're gonna put your marker in the light and put it PA. If the patient's PA, put your marker.
If you do this position AP, I angle the other way.
Yeah. Now, go
Okay.
ahead and
Okay, just be,
all right, now, the most important view in a sinus series is the waters.
the waters.
The waters.
Okay.
That's for the maxillary sinuses.
To
and
see the fluids.
99% of people have fluid in their
Okay.
maxillary sinuses. You're going to extend the chin up.
Okay.
Now, if the patient
this
can't
yours?
extend their
Yeah.
chin,
Should we turn the light on so you
No,
get better light?
yeah.
No, it's okay. Because believe me, when I put it on the TV, like a movie.
All right, now, you try to get the chin as extended. If they have a bad neck, you angle down.
Okay.
You angle 5 to 15.
If they have a bad neck, so
If they can't get their chin up high, that you want to bring the chin as high as you can get it,
Mhm.
because you want to get the orbits out of the sinuses. That's
If
why.
we're on a kid, and kids sometimes can
Yeah.
extend too far.
Yeah.
And his nose doesn't need to touch
No,
like
no.
the skull.
And what you do, you center at the maxillary sinus. Okay, go ahead and do more. Go ahead, do the one.
Yes, sir.
And he's one of these old men with bad necks.
Oh, bad. Why?
And they really have to stand behind him.
And you gotta look at the ear, make sure they're balanced in
Well,
the field of view.
Yeah, and
But you say we don't have to calm down.
well,
to,
open the cones till you see the ears.
so I know he's perfectly.
Now you cone in.
Where's your phone, Tom?
And then.
Right there. And you can look on here. This up.
Can you open your
Yeah.
camera without?
And then the
Yeah.
central ray.
It goes
Well,
to
I
the
can see.
maxillary.
Yeah, I can see on this side
Yeah,
for
yeah,
sure.
you can see the maxillary sinuses.
So right there.
And,
About a half inch again. Half inch
Yeah.
is the key so far.
and this view shows more of the
So-
face than
The first one was a Caldwell, and
Yes.
how is this one called?
a water view.
Waters.
Aqua view. Now you ask the patient, where do you hurt?
Which
Sometimes
side?
they'll hurt on the right, sometimes they'll hurt on the left.
Yeah.
So whatever side they hurt on, you do that now. What side's hurting you, sir?
Oh, my right side is hurt
All right.
bad.
Now you're gonna,
So
right?
the right side you put against the
do a lateral, do a lateral
skull and central perpendicular to the beam. So sir, I'm sorry, I'm so sorry.
I'm gonna move.
Now the beam should be at 40,
Yeah, it
right?
should be at 40, but we'll.
So, sir, I'm
my
just
right
gonna
side.
put you
Now,
right there.
you're gonna center at the edge of the eyeball.
This
Because
time we don't
You
go-
don't care about that. You wanna see the sinuses.
Okay,
You know, this is the
Looks like
sinus.
you're in a line up.
right
Take it
there.
back like there. Tuck your chin down, sir.
And
See them baby boobs?
lower the
And you-
Yeah.
central ray,
Just
half
a little
inch,
bit, yeah,
right
Yeah.
there.
Ma'am, I want you to order me around more.
yeah.
And collimation, you don't need all that,
You don't
correct?
need all this. You bring them forward a little
Okay.
bit. Now, the next view, I know this, you can't do it.
So for the
Something
sinus,
reversing.
I can do
the
that.
sinus, you pick the lateral you're gonna do depending on the
Okay.
area of interest.
Now, the next view, a lot of places don't do this, but a submental vertex. That's for the ethmoid. They're within your brain.
So those are the
And
little
speed.
weird bones
That's
that
what
come.
it's-
Now, this is where angulate. This is where the light comes in. Now,
And that's called what?
submentovertex.
SMV.
SMV. Now, we're going to look at shadows again. This is also used for the cheekbones.
Oh, you're gonna bend him back. Yeah.
Now, you
And
see
you're gonna
that?
go in the foramen.
See the nose?
Yeah.
When you see that nose, the nose, see right there?
Perfect. He's got beautiful.
And then you, then you,
I need to trim my nose hair.
see, and sometimes, now see, he went crooked on you.
And the central ray is gonna be right there.
Right there, but if they can't do it, then you angle.
You angle.
You angle
Up?
until you see the nose, yeah.
Okay.
And it's you do not breathe and swallow.
Okay. That's not how they did that. They angle
Slam
the
your face
patient
into
like
the
this.
It's very bright.
No.
But this
I
is
don't know
more
if any of them are any good or
practical.
you want any
It
of
is.
them, but I was
It
just, it'd be cool.
That's
Send them,
funny.
to send them to Jules and this guy.
All right, now,
Make you guys superstars.
facial bones.
I'm making a move here,
Now,
man.
facial bones.
I know you are.
Facial bones.
A normal facial bone is generally 4 pictures. Now, I do mine without angulation. I angle the head.
Okay.
You angle the head.
You don't angle the.
Not unless you have to. Usually you ask the patient, or you can look at them. If they got an eye this big, then you're going to do the facial bones that you get 3 shots of the orbits. You get the upper orbit, the middle orbit, and the lower orbit. If they've got a big knot on their eye.
Strong work.
You out here?
All right.
See you next week, right? You're not here tomorrow?
Yeah.
Okay. See you next week.
Have a
We're doing
good
one on
weekend, man.
Wednesday.
I'm here.
Hey, I appreciate
You'll be here
that.
tomorrow. I'll see you
Well,
tomorrow.
I'm working for Ryan tonight at 2 a.m. I'll be here.
10 at night?
No, I'm coming in 2 a.m.
Is that 10 in the morning?
Yeah. Well, something like that. Yeah. But now, whatever the patient, a facial bone, if they don't have a mark on their face, you do the normal series, which is the PA.
So if I may interrupt, a lot of these views are the same depending, okay.
Now, if it's for a regular facial bone, say they got a couple of their faces.
They got a black eye, he got beat up.
They'll order orbits, and I'll tell you how to do those. But your regular technique is usually 4D.
So we're back to the PA skull.
Yeah. Now I do the PA straight.
Straight.
Yeah. Tuck the chin a little, bring it a little more. I tuck the head.
And I see how you handle him.
Yeah. Instead of
Yeah, his nose is away from the...
I've been held like this.
Okay.
Me too.
Now, you just gotta bring it.
Central ray is same spot.
Well, you just want
You don't have an angle anymore.
No,
though.
I'm angling his head. This is the first one. You can angle 10 to 15, but I'm
Okay.
angling his head forward.
Okay.
Now the next one, his nose and eyebrows gonna touch. I'm just moving his head up a little bit more. Kiss it. Kiss the thing. Nose and lips.
Yeah.
Nose and lips. I don't want to
Nose-
put my lips on here.
Well, just say nose and lips.
Nose and lips.
Yeah, these are, the series.
I don't want to put my lips on here. Call me crazy.
Alright. Now the next one is a water's view. Water's view shows every bone in the face.
More importantly, a Waters view shows if you have an orbital blowout fraction.
Right. Right. It shows the tripod. And on the water's view in the sinuses, open the mouth.
Open the what?
Open the mouth. Well, I forgot to tell you that. When you open the mouth on the water's view, you can see the sphenoid sinuses.
Okay.
The teeth aren't in line.
Right. And if the patient has false teeth, tell them to take them out. It's pretty without all them, Now, do a water's view.
The one like that.
Yeah, it's
Okay.
the same thing. If he can't get his
Yes,
chin
sir.
up,
I'm gonna push you while he's not gonna touch his lips.
no, he's going to try to extend his chin up.
Right now my central
That's
ray
pretty
is
good,
good. And it's angled.
Yeah, and you want to get the mandible to the glabella. You don't care about the top of the skull.
Yeah, because we're doing the frontal.
We're doing the facial bits. All right, now you do a lateral facial. They got a big knot on the right side, you do a right lateral.
So, sir, I'm gonna...
My right side.
So that's the same view that the other two that we just
Well,
did. And then I come half inch below the...
you want to include the mandible.
Right there, you're perfect.
You want to get the bottom of the mandible. Hey, can you see the baby blues?
Yeah, he's got...
All right, now see, you can go from say, maybe an inch past the ear or a finger and a half.
Uh-huh.
But you don't want all this. That's not part of your facial bone. You want all these.
So you collimate, yeah,
You collimate.
facial bone is all in
Right.
front.
Are we boring you?
No,
That's the normal.
It's like
Now-
class.
So you always do a lateral depending on the side,
The side
of
that
problem.
it's hurt. Now I'm gonna do the mandibles now.
Well, look,
Oh, man. When
here.
did you ever do animal? I've
Orbits.
had done one since I've been here.
Yeah.
I got
Which is
orbits,
a mirror.
zygomastic arch,
Gymnastic.
and mandible.
The bucket hand.
Let's do the let's the same thing as SMV.
You can,
Yeah,
if you
yeah.
get tired, you can do it on me.
Scoot back.
It's videotaping.
No, we
it's
doing that.
beautiful.
Oh, I thought we were doing the bucket hand.
We're doing this one. We're doing mandibles.
No, that's a mandible.
This is the AT. I just use sort of like a neutral shot.
Neutral, so no
Yeah.
angulation.
No.
Is there a name for this view?
No,
AT mandible.
AT mandible. This gets this shot. The best.
The collimation, does it need the eyes?
No.
We can tone down.
Yeah, I don't have it.
Because the
set.
mandible starts right here,
Yeah.
right?
But you want to get that in there.
Yeah, of course.
But you want to also, he's got a little bit of chin chin.
We all do.
Hey, hey, hey.
Now, the next ones are the obliques.
Ooh, these ones are the hard
They're
ones.
hard ones. Now this is where shadowing.
So
This one's a pay attention big time.
you do a AP mandible,
Right now.
and then you do obliques.
No, we're gonna get the ramus. This gets the front part of the mandible,
You need this.
and then you need this. So it's 30 degrees to 35 down. Back.
You pretty hard.
30-degree down.
Now tuck your chin way down. This is where you gotta get them to tuck it. Now you want to bring it through the
The ears.
TMJ. See, it's a 30 or 30.
Right there.
Yep. TMJs. And you have them tucked as far, the further they can tuck down. And this is going to be real low. You're going to think, oh my God, it's so low. But you've got a steep angle on it.
Yeah, of course, 30
Steeper angle.
degrees.
Yeah, and you have to use a little more
It's a lot
mass.
like it sounds.
Yeah, it's a steep town.
More mass because of all this tissue
Yeah.
to go through.
Going through this.
And collimation,
Well,
no
you've got to
collimation?
see that you've got to have it open to the ears. But you got to see this right here.
oh, I see. Man, I'm glad I'm videotaping this because that's gonna come handy, Tom.
It's going down. Now, the next ones are their bleeds. They're tough. This is how I see my angles. Now, I have a patient turn this way. Now you're going to angle 12 to 15 degrees up.
These are tough.
They are.
You
They're
should,
tough.
you should actually roll the table down a little bit so he can.
Yeah, tip the table because it's an angle.
This is really pretty tough.
You want to see, grab your book. Because I want to be able to get this angle. Because the angulation is very, a lot of x-rays are angles, shadows. Now, you have the patient turn lateral and they're going to cock their head 45 degrees and they're going to extend their chin up.
45 degrees, so I could put the pillow here.
Now, see the shadow you're seeing?
Yeah. see
Now
the
you want to
nose?
get this part, because you're going to get both sides.
That's where the joint is.
Come look at the shadow. See the shadow?
Yeah. It's very
You
interesting.
can see it
And right there again in
in the
the.
middle of the mandible.
Right
You
there.
see that shadow?
Yeah. Yeah.
Now turn the other way, Tom, and we'll see it better. We're doing RO implant here. Okay.
These are tough,
Go ahead
man.
and cock his neck.
Okay. So sir, we're gonna angle 45 degree.
And have him look up, chin up.
The central right
Yeah,
there.
Now you're gonna have to bring his chin up. Sometimes if their jaw broke, they ain't gonna be able to do some of this. Now, his shoulder's in the way, so you have to tell him to relax. You see that shadow?
That's what we're
That's
looking
the
for.
shadow you look for. Right there. You can
Okay.
see the nose.
She loves shadows
Yeah, I'm shadow.
because it shows what you're projecting.
Yeah.
She's old school. She knows what she's
Yeah,
talking about.
No,
These are hard.
They all hard.
I miss these fuckers all the time.
Yeah,
Really?
you always repeat. Now the SMV. Go ahead and do the SMV. Oh, we don't do that for the jaw.
No.
SMV was the
No.
force.
Yeah. Now we're gonna do,
The force of the paranasal.
right. Now, we're done the mandible.
Mm-hmm.
We're gonna do these sitting up, and then I'm gonna show you trauma on the backboard. If the CAT scan machine goes down, you go back to X-ray. If you're in a trauma room and say,
He would know the best is the CAT scan specialist.
yeah, but if the CAT scan goes down, then they're gonna go to regular X-ray.
If CAT scan is down and I need facial bones and I'm on a backboard, I'm calling her. Because I don't know how to do that.
Yeah, and I'm gonna show
I'll give you a lateral.
Yeah.
That's what you'll get from me.
Yeah,
That's it.
oh, no, I'll give you everything.
Well, you
Alright.
can do Caldwell, the pounds. No.
Well-
Not on a backboard.
On the backboard is very hard.
Oh.
Uh-huh.
On the backboard.
Yeah,
no.
you have to put the cassette
First of all, you
under
don't
the
want me on a
back.
backboard. Huh?
And if they're hurt, I can imagine how you do
Well,
that.
they're 99% they have a neck
Well, if you
collar.
get one at 2 a.m., wake me
Yeah,
up
well, they have a neck
before
collar.
you go.
All right, now we're gonna do the orbits now.
Yeah, yeah.
Now, orbits you do You do a PA in the water, don't you?
I do and a Reese.
Yeah, then you do use. But I do a PA in the waters.
Actually, yeah, I just do a waters and a Reese.
You want to see different portions of the organ. I do a PA and a rip
Start doing a PA.
yeah,
So you do a standard PA skull?
yeah.
PA skull?
Yeah, you want to get the orbits. Now, you're going to center in the dead center of the orbit itself.
This time, so but it's the orbitum middle line.
Yeah.
Orbitum.
You can bring it a little less PA because you want to see different areas of the orbit. You don't see the whole orbit in one. You got to give them two views of the orbit PA. Now, you center the eyeballs. You can tone in, but get your marker down here. Now the
Always
next,
in the light,
yeah,
the marker.
always in the light. And the orbits are a little more shallow. Now you're going to do the waters. That gets the lower portion of the orbit.
Okay, this shows the orbital blowout.
Yeah, it shows the tripod fracture.
Radio, please dial
Waters and Caldwell are named to.
And now the Reese, it's a 53-27 angle.
That's the third view?
Third and fourth, you do bilaterals.
Wreath.
5327. I'll be interested. That's not how I do them, so I'm interested to hear where.
PA, and you turn the eye. You're going for the eye down. Now, this is my trick with your orbits. You want to tuck the chin down, and you're doing the eye down. If you see the eyebrow and the eyelashes, you got it.
And where is the central ring?
It's in the eyeball.
It's too high, right?
It's in the eyeball down. Bring it down.
Yeah, so I figure right there.
But you can look to see if you're.
So again,
you
the
can-
shadow trick.
Yeah.
Which
if you
is the
can-
shadow. If you
yeah,
can see the shadow,
you can
there's
see the eyelash.
there's the eyebrow there.
Yeah, and this also.
You angle the tube down, Joel?
No, I
No.
should straight. See, and
It's
you're
beautiful.
gonna.
I see it.
When you get this, it looks like a little hole in the dead center.
That's
gets
the
your
optic fluid.
optic frame. And you also get the soft tissue of the other eye. If there's glass or something, you can see it.
And if there's a fracture along this side of the
Yeah.
orbit, you can
Yeah.
also see.
Nice.
then,
And you do it both sides. So sir,
Yeah. 53-37.
I'm gonna do the other side now.
Tuck your chin down.
Chin
37.
down.
And you
I
turn
can
it.
see the eyebrow very well. The central well is too high, so
You want it in the eye. You want the.
I'm gonna lift you a little bit, sir, right there,
Side
right there. It's perfect. Look at the
Yeah.
eyebrow.
Yeah, and you can see the eyeball.
So the eyes, the
You're looking for the optic frame,
the holes
the side down.
where the nerves of the
It should be
finger.
a pinhole.
And if there's glass, you meant in the soft tissue,
Right, you're gonna
not
see-
in the.
You can, if there's glass in the glabella or in here, if there's a tiny fracture here, you'll see that too. So you want to get both sides on.
Absolutely.
But your central ray is the side down. But the side up, you can see a fracture there too. Because your radiation is going to the optic nerve, and this is like a little shadow.
And I noticed you keep the 8x10 throughout all the procedures we did today.
Yeah, 10 by 12.
You calm down when you do the lower. Okay.
All right, now that's the orbits. I get a sweet one.
So the orbit, you
What?
do the wreath oblique.
What's that?
It's looking up the book, sweets,
Sweets?
for the eyeball.
Never done that. Although I did do a C-arm on a vagina one time.
Did you? That's,
did.
I've never done that. I've done a ball, another green.
Notogram? No, this was the surgeon had tried to sew her up after having a baby and lost the needle. So it's in there somewhere.
All right, now we're doing the zygomatic arches. Now let me see.
You want to go, Tom?
You go see, make sure if there's no CTs over there.
Okay. Oh.
And in the meantime, we'll talk. Now, all these.
Oh no, my focus is lost. I'm gonna